Hey, we get often asked, why do we think that medical weight loss is best done in the context of a primary care relationship? Because that's how we do it at Big Tree. So primary care is involved in the healthcare system at the level of individual relationships. So as a primary care doctor, my job is to take responsibility for the health and well-being of my patients. And so you're really my responsibility if you're my patient, whether it's 2 a.m. And you're having a question, or you're at a specialist office and have questions that you don't feel like the specialist is answering. It's still my responsibility. And we take responsibility for your whole health. So that includes weight. And we know that weight, especially people who suffer from obesity, really manifest as diseases in a lot of different organ systems. And so, whether that's arthritis or sleep apnea, heart disease or kidney disease, obesity really affects everything. And so, dealing with it in the context of a primary care relationship where we're helping manage your whole medical um, system, we think is optimal. Just as an example, if you've got type 2 diabetes and you decide to do medical weight loss, we may want to stop one of your diabetes medications and replace it with a medication to treat your um, your obesity. Another example, if you've got heart disease, you may qualify for medical weight loss medications at a lower body mass index than somebody that has just just obesity. So primary care, we think, is the place where the medical weight loss battle should be fought. Now, the problem is most primary care doctors are overwhelmed with their patient load and they don't have time to take on the additional burden of managing obesity, so they often refer people to obesity specialists. Um, Obesity specialists are great. The problem is they are not responsible for your whole being. And while there are good ones out there, we find that a lot of the online medical weight loss programs are just interested in making money off of the medication themselves. At Big Tree Medical, we have the cheapest medical weight loss drugs on the internet because we're making money off the primary care relationship. Medicine is a business like anything else. We have to make money to survive. We make our money off your monthly membership and then have a pretty trivial markup on the medications themselves, which is why we're the cheapest place on the internet to buy them. So, primary care is the place where this should be dealt with. And we do that at Big Tree Medical in a way that really takes all of who you are into account.